Taking an integrative approach to our health and wellness is not only about the absence of disease, it includes looking at our emotional, social, and psychological states, along with our environment and our physical bodies. Dr. David Allen is a pioneering figure in alternative medicine, and we welcome him today. Welcome, David. Let's talk.
Nice to be here, Rochelle.
Thank you so much. So listen, I wanted to ask you if you agreed with this statement.
Absolutely. Up until very recently, medicine has been more disease-oriented. If you have a disease, Western medicine can be very good at treating it. But there's a lot of people that we call vertical illness. They're not horizontal in bed, they're vertical, but they don't feel good. In fact, the number one complaint of anybody coming to a doctor is fatigue. So when we take an integrative approach, we tend to look at the body as a whole. So we don't go to the ear doctor, the throat doctor, the heart doctor, the GI doctor, all seeing the body as a piece. We see the body as a whole. When we think of the body as having what we call a homodynamic field. As we age, that homodynamic field gets smaller. So the question is, how can we optimize health? How can we keep ourselves healthy using emotional, physical, nutritional means so that we avoid all the chronic degenerative diseases that plague so many people? If you live to be 55 or 60 like they did 100 years ago, and you had a couple bad years at the end, so be it. But if you live to be 100, 110, and have 25, 30 bad years at the end, then we're talking about significant suffering. So how do we maintain our vitality, live to be 100, and enjoy life? Enjoy our sexuality, enjoy traveling, enjoy our friends, enjoy our grandkids. And that's what we're really looking at. The current model is deficient in this way because more and more people have chronic degenerative diseases because they're treated symptomatically. So integrative medicine tries to look more at the core, the biochemistry, the underlying pathophysiology that creates diseases and starts working from there.
So basically, we have control, some control over our aging if we take that approach.
There's about 70% of all chronic diseases are caused by lifestyle.
Right.
Now, thousands of years ago, the people that survived because they could survive infectious disease and parasites. Because really nobody lived more than 25, 30 years ago, 40,000 years ago. But now when we're going to be living older, we've handled a lot of chronic degenerative diseases and infectious diseases and parasites. But now we're faced with an epidemic of Alzheimer's disease, epidemic of cancer, cardiovascular disease, all the things that our ancestors didn't have to deal with, but now we have to deal with. And so it requires a new way of looking at medicine.
And that's the holistic approach, and that's where you combine alternative types of treating, but you treat disease. Tell us about disease.
That's right.
Okay.
We call it integrative because it includes the best of Western medicine. And the truth is, traditional Western medicine is incredible in its diagnostics.
Okay.
We have MRI machines. We have all sorts of diagnostic tools. We have surgery that's incredible. But we also want to include lifestyle modification, hormone replacement, heavy metal detoxification, a lot of different things that begin to affect people that traditional Western medicine has overlooked and is very poor at. So that's what we try to do, combine the best of both worlds.
And so preventative things, we can do things to prevent, and that is based on our choices, our lifestyle choices is what I'm guessing.
That's right. So just take cardiovascular disease, the number one killer in America. There are certain people that are predetermined genetically to develop cardiovascular disease, but that's a very small percentage.
Mm-hmm.
The vast majority of people could live a long life without developing a heart attack, a stroke, etc. But because of our diet and lifestyle, and granted, it's not easy. As we get older, it's harder to get to the gym to exercise. We're busy. We've got raising kids. We've got a business. We've got all sorts of things going on. It's also harder and harder to eat correctly. About 2 years ago, I was driving on the freeway in the morning, and I saw this woman driving in her car. She had a hamburger in this hand. She had a coffee in this, sitting over here. She was combing her hair, and she had about 5 things going on at the same time while she was driving to work. And of course, then you look on the TV show and you see people, do you have acid indigestion? Do you have reflux like almost everybody does these days? Well, that's not the way to be eating to promote optimum health.
Right. So, I mean, clearly, and she was also trying to drive. So
She was
that's,
trying to drive.
that's a bit of a problem.
That's not good for your longevity either.
No. So tell me, what is functional medicine?
Like I said, functional medicine looks at the underlying cause. So if we look at any type of disease, a disease doesn't happen overnight. It sometimes takes many years to develop. So we look at what are the antecedents. In our office, we do 7 different genetic tests, just on our basic test, to see if a person has any predisposition to any illness. We look at their early history, look at their in utero history with their mother. We look at their family history. Did they ever inherit any weaknesses? Those are called antecedents. And then usually there's a trigger. Maybe the second baby's born and it's pretty traumatic and it triggers an illness. Maybe there's a particular stress in a person's life. Maybe there's an accident. But there'll usually be a trigger that triggers the illness. And then the body starts creating certain mediators that begin, inflammatory mediators, different mediators that actually begin the disease process in the person. So we look at those things and we look in the different areas of the body. How are the mitochondria, the little cells in the little organs in the cells that produce energy, how are they functioning? If they're not functioning well, then you're going to be tired. And since mitochondria come from bacteria originally, and they come from your mother's side of the family, if you take antibiotics, they can affect the mitochondria. How many times do I see people, they've had a serious illness, been on heavy dose antibiotics, and for 6 months after, they're tired.
So they basically killed all their good...
They injured their mitochondria.
Mm-hmm.
Toxicity is such an important thing these days. I can't tell you how many people that when we test for organophosphate pesticides, PCBs, solvents, etc., that have high levels that are affecting their immune system, high mercury, high lead, high cadmium. We're not talking about the odd case that's an environmental exposure by the factory. We're talking about everyday people. We have 1,000 times more lead in our bones today in our system than they did prior to the Industrial Revolution.
What does this come from?
It comes from the environment.
Breathing?
Breathing in. When they fire up the coal plants in China, within 48 hours they hit the west coast of the United States. So when I was at UCLA 30-some years ago, autoimmune disease was somewhat rare. We did see cases at the university hospital, but now it's so common. And why is it so common? Because our bodies are absolutely being polluted from the environment. And it's one of those things that doesn't get a lot of press because if we really told the truth about it, we'd have to do something about it. I was recently at a conference where they sampled every fish from every part of the world. They couldn't find one fish that didn't have some mercury contamination.
Oh no.
So it's really getting serious because fish is a good food. So a lot of times we'll look at the toxicity of a person. We'll look at how their mitochondrial function. We look at their gut. So a lot of people don't understand that 90% of your immune system lines the gut. So if there's a dysbiosis, which means an imbalance of bacteria, there's more bacteria in your gut than you have cells in your body. If there's an imbalance there, it can upregulate the immune system and exacerbate, make worse autoimmune disease, allergies, etc. So I had a lady come in a while back and she has rheumatoid arthritis, and the first thing I said, we need to look at your intestinal tract and look at your bacterial flora. And she said, I don't think you understand, doctor. I've got joint pain here. And so I had to explain to her, no, the gut is a very important area regarding your immune system. So an integrated approach looks at all these different levels, and it allows us to treat things that have either been untreatable before or people just put up with.
So the gut in this case is your intestines,
Small
your
intestine,
stomach.
large intestine,
Okay,
that's right.
okay. So in your office, I mean, since social and spiritual and all of that is involved, there must be a very close doctor-patient relationship.
I try to be close with my patients. We spend, when I see a new patient, I spend a good deal of time with them, taking their history, examining them. And I had the fortune to train with Dr. Worsley in England with traditional acupuncture years ago. And before I went there, he said, come with me for a year. Even if you never stick a needle in a person, it'll be worth your while. And it really is, because in the type of acupuncture, Oriental medicine, we learn just looking at a person, hearing the sound of their voice, seeing how they move, you can begin to understand how their energy is working in their body.
Wow.
So we like to spend some time getting to know the person, and we do a pretty intensive blood panel. We do advanced cholesterol panel. That's something we may talk about because a lot of people don't know about that. We do genetic testing. We test all the hormones. Very, very important, although it's controversial these days. But appropriate use of hormones is a very, very important thing for maintaining your youthfulness and longevity.
Yeah, well, hormones, we all have different levels of hormones, so they're going to affect us in different ways at different stages in our life.
That's right. So, for instance, prior to menopause, most women have a very low level of illness, disease. Post-menopause, cardiovascular disease starts catching up with men, osteoporosis, dementia starts increasing, just dryness in general, colon cancer, all these things begin to increase as the hormone levels come down. So, since most women, as I said, live more of their life post-menopausally than pre-menopausally, we want to make sure they stay healthy. We want to avoid the bunched over osteoporosis, the lack of sexual energy, the wrinkling of the skin, etc., like that.
So this type of approach would be really beneficial for women especially.
Women and men, I'm seeing more and more men in the practice because men are also more interested in maintaining their vitality too.
Well, good for them. We're
Yeah.
going to take a quick break. So combining traditional and alternative medicine is becoming more and more common. But is it right for you? We're going to find out more when we return on Let's Talk.
Hey, slow down!
Right next to the library on 7th Street is the Santa Monica History Museum, where history comes to life for the entire family. Enjoy the exhibits, main gallery, the photo archive, research gallery, and much more. Come visit the Santa Monica History Museum, keeping history alive.
Even if a signal indicates it's safe to walk, it's never safe unless drivers see you. Last year, 113 pedestrians were injured in Santa Monica. You don't have to go to extremes to get a driver's attention. It just takes a little eye contact. Take the right steps to be safe. Watch the road.
Though not mainstream quite yet, integrative medicine is the way of the future. Dr. David Allen is explaining the reasons why we should all be thinking holistically toward achieving optimum health and wellness. Okay, David, I wanted to ask you, I know there's got to be a reason. What personal experiences did you experience as a result that brought you to this practice?
Well, I think you have to go way back to when I was an undergraduate at UC Berkeley, and that's when the Beatles went and started meditating. And so when the Maharishi came to Berkeley, I started meditating. So it sort of got me interested in doing something a little bit differently. And then when I was in medical school, I started studying martial arts. And one of the women in the class, which I befriended, her father was just coming from China. He was an acupuncturist. And so I started getting interested in that way. And then when I finished my training, our family doctor was sick. So I went into his practice for 3 months. At the end of 3 months, he said, How would you like to come in as a partner? And what I told him, I said, don't be offended, but I'd rather quit medicine than practice medicine the way you're practicing.
Wow.
Penicillin shots, pills, pain medicines, treating symptom after symptom. And that's when I went to England to study acupuncture. And that kind of led one thing after the other, and where I am today.
So you knew right away you wanted the holistic approach. It wasn't just about treating symptoms.
It wasn't about symptoms because it's so unsatisfying just to write a prescription all day.
Exactly.
Yeah.
So is this type of practice, this integrative, for everybody?
Well, it could be for everybody, but it's more like a partnership.
Okay.
So I tell people, I take care of my side of the tennis court. You need to take side of your tennis court. Now, I'm going to try to make it easy for you so that you can actually comply with what we're doing, and I also try to explain it in detail. So this is why we're doing this. This is why we're doing this. This is why we're doing this. But still, a person has to be ready, and a person has to be willing to, and a person has to see the relevance of it to start taking care of themselves. Because I can't do more than advise.
Right.
So
So
hopefully I can inspire, but the person has to do it themselves.
yeah, well, I think that's true of everything. We have
Yeah.
to be disciplined to do it ourselves. So if I wanted to come to your office, what would a visit to your office be like, my first visit? Tell me about that.
The first visit, you would come in, and I would meet with you for about an hour. That's a little different from most doctors, but I meet for about an hour. I take a very detailed history. I do an examination, and then we talk and decide what particular tests might be needed. Our baseline test, like I said, does a advanced cholesterol panel. That's really important for your advisors your audience to hear, because what I tell people is it doesn't matter what your cholesterol is. So people say, yes, but what level do you want my cholesterol? I said, it doesn't matter. You could have a cholesterol of 300 or 150, and both could be okay or both could be not okay. So you have to do an advanced cholesterol panel, which we do. We look at multiple vitamin levels. We look at 7 genetic tests, because we're trying to see how you're unique as an individual. Not just, hey, this sounds like it's good for everybody, but what do you particularly need? We check all your hormones. We check the traditional chemistries. We check your thyroid, etc., like that. Now, my orientation is a little bit different, because if you look at the normal range for a blood test, here's the low and here's the high, a lot of doctors are going to say, oh, you're in the normal range, don't worry about it.